Psychiatric and Behavioral Emergencies. Mental status examination. What was the mechanism of injury or nature of illness? Injuries and illnesses can cause altered behavior. Was it a head injury, hypoglycemia, hypoxia, a stroke, dementia, possibly medication side effects, and check for mental health history. Check for the patient's general appearance, the way they dress, grooming, posture, wringing of the hands, facial grimaces, mannerisms, actions, and violence. Listen for their speech. Is it spontaneous or pressured? Slow or fast? Soft or loud? Is it understandable or not? Is it appropriate or inappropriate? Are they using mixed or confused words? Are they using full words and appropriately used together? Is it a delusional speech? Look at their mood. Are they depressed, euphoric, manic, anxious, angry, agitated, fearful, or guilty? And look at their area of thought. Are they having racing thoughts, possibly hallucinations that are auditory, visual, or somatic, which is strange body sensations? Are they having obsessive thoughts or delusions of false beliefs? Are they feeling suicidal, unconnected, disturbed, or distorted? Once you have completed a mental status examination, you should report their general appearance, their speech, mood, and area of thought. Restraint techniques. Physical restraints. Attempt verbal de-escalation prior to physical restraints if safe. Provider safety is important. Ensure scene safety and leave the scene if weapons are present. Restrain only those who can be overpowered with the physical forces available to you. Use only the force necessary to maintain control and prevent injury to all involved. 5 people should be available to apply full body restraint, 1 for each limb and 1 for restraint application. Pre-plan each provider's role during restraint. Know your communication signals or verbal cues. Swift, coordinated action is most effective. Talk to the patient continually. Do not remove restraints in the out-of-hospital setting. Thoroughly document restraints and consider legal considerations in law enforcement custody and age. During transportation, ensure continued ability to restrain. Ensure adequate personnel and equipment. Principles of restraining motion. Understand the normal range of motion, restraining range of motion, and understand the muscle groups. When using physical restraints, consider if the patient is pregnant, pediatric, or geriatric. Environmental restraint. The emergency care provider may want to stabilize the environment. Calm the patient via therapeutic communication techniques. Or separate stimulus from the environment. Separate 2 fighting people, remove law enforcement from direct view. Agitated delirium and excited delirium. Stay calm and do not cause more harm to the patient. This can be characterized by a sudden onset of extreme agitation and extremely irrational or combative behavior. Combative behavior may result in bizarreness, aggressiveness, agitation, ranting, hyperactivity, paranoia, and/or panic. It is reported to result from substance intoxication, psychiatric illnesses, alcohol withdrawal, head trauma, or a combination of these. The patient may exhibit hypertension, tachycardia, diaphoresis, dilated pupils, tachypnea, abnormal tolerance to pain, hyperthermia, noncompliance, and endless endurance and strength. It may lead to respiratory and cardiac arrest. Restraints may increase the risk. Suicide and depression. Risk factors for suicide. History of depression and other mental disorders. Previous suicidal gestures and/or attempts. History of family and/or child abuse. Feelings of hopelessness, and unwillingness to seek mental health care. Feelings of being isolated from others. A history of impulsive or aggressive behavior. The inability to access mental health. Recent diagnosis of a serious illness, especially an illness that signals a loss of independence, or a recent loss of a loved one, job, money, or social loss. The patient may have access to firearms, have PTSD, alcohol or drug abuse, loss of a relationship. They may give away personal belongings or cherished possessions, and have physical or mental stress. A few other risk factors may be a major physical stress such as surgery and long periods of sleep deprivation, expression of a clear plan for committing suicide, or the ability of the mechanisms to carry out suicide.